Thank you very much. Thanks for the invitation. I'm happy to talk about HGRT adoption in modern radiotherapy and how it has become quickly a new standard for radiotherapy treatments. I'm a clinical specialist with Vision RT, and I work within the region to increase adoption of the HGRT for the whole radiotherapy workflow. And the idea behind SGRT when it started to kind of permeate radiotherapy was that what are the challenges now, that every department within the radiotherapy field handles. And really, when we talk about with modern radiotherapy, with the decreased PTV margins, increased amount of imaging, that we really think about, I'd say, the accuracy of delivering radiotherapy, patient safety, whether we are still getting the tumor, or we are delivering the sufficient dose to the tumor and sparing organs at risk, and whether we are doing this with increased patient comfort and with efficiency of time saving and delivering the treatment in a timely manner to reduce the likelihood of intrafraction motion of the patient at the table. And really all of those common challenges can be addressed with ability to image the patient and image the real time, and also ability to position the patient in the same golden standard with the same geometry as we obtained in the simulation. Now, if we talk about what is the really surface-guided radiation therapy and what does it entail in radiotherapy, I mean, what the surface has the usage for, we really think about that the SGRT is now a solution for the whole radiotherapy workflow. So whether we use the surface imaging for simulation now as a new solution for surface imaging for plaque, or for monitoring directly the beam. So the idea here is that the radiotherapy as a whole is really improved by the whole SGRT aspect. So we are utilizing this solution for increasing efficiency and effectiveness and accuracy of the whole radiotherapy workflow by giving the patient a better option for radiotherapy. So how does the SGRT work? In a nutshell, it's surface imaging, of course. We are having a specialized stereoscopic cameras mounted in a bunker setting, or whether we're talking about the treatment or in a simulation on top of the CT gantry. And those stereoscopic cameras project a specialized pattern onto the patient's skin. If you look at this pattern, it looks similar to a QR code, which I'm sure everybody's familiar with. It gives a bit of a texture to the patient's skin, and then the stereoscopic cameras, utilizing the same principles as human eyes, reconstruct this speckle pattern into the 3D surface in real time. So that reconstructed 3D surface then is compared to your original reference. So whatever way you scanned your patient, whatever way you generated a 3D contour, you are doing a real-time fusion between your live patient position versus the reference position for the whole treatment process.
Patients move. So we move the bar on safety. A line for T uses surface imaging to track the patient's position in real time with 7.5 millimetric accuracy. From initial setup through treatment, 3D stereo cameras project a pattern on the skin surface, creating several thousand reference points. The system accurately monitors patients' movements in real time in all 6 degrees of freedom, and can automatically signal the treatment system to pause if the patient moves from the desired treatment position. Align RT adds no additional ionized radiation dose and is routinely used in a broad range of applications, reading sites from head to toe. The result? Greater accuracy. Reduced imaging dose. No invasive frame to expose mass. Time savings. From the leaders, surface-guided radiation therapy empowered to deliver treatment as planned. That's peace of mind.
Just to give you a basic idea what SGRT is capable of and how it works in the clinical setting. So the first one I mentioned about accuracy and ability to monitor the patient's interfraction motion management. And one way to do it is to actually utilize the feature within the treatment part of SGRT called Align RT, and this feature is called the postural video. So what you see here is the live video feed coming from the bunker within the cameras, and what's overlaid on top, these are the contours generated automatically by Align RT, by SGRT system, to tell you where the patient needs to be and where they're supposed to be going as part of the general postural setup. The outlines are generated from your reference surface. So whatever way you scanned your patient, whatever surface you created in the treatment planning system as part of your planning process, this is imported and automatically transferred into those contours. So you would know where your patient needs to be and where they are at the moment. This helps you to facilitate normal current trend in radiotherapy called tattooless and markerless setup, where you're not relying anymore on specific permanent or semi-permanent marks on the patient's skin to set the patient up completely on the table. On the left side, you will see something we call the real-time deltas. So the deltas are actually now telling you patient's submillimetric positioning versus the isocenter. And normally we would have a feedback or connection to the LINAC where we'd be able to send those deltas directly to the specific LINAC couch and move the patient automatically towards the isocenter without a specific manual handling from the RTD therapist, just to reduce that type of workflows and also increase the efficiency and decrease the treatment time of radiotherapy. If you talk about the utilization of SGRT within the whole radiotherapy, you can go, like if you go into the PubMed, type SGRT, type Align RT, you will find now over 200 specific clinical publications discussing accuracy, clinical usage of SGRT solution in treatment, as well as the clinical outcome-based SGRT results. So, for example, for specifically like DIBH, breast treatments, SRS, SBRT treatments, you name it, you can treat from any side from head to toe with SGRT with no detriments, because there's no added radiation, there's no added X-ray, and the system can be on from start to finish during the whole patient treatment. Initially, when SGRT it started to become a standard of treatment within radiotherapy, people wanted to look how good it was specifically handling with superficial targets like breast, and the left breast radiation with the DIBH technique with inhale was of course a big benefit to the patients, since would be sparing the heart and LAD from significant dose of radiation, decreasing any coronary disease effect later down the line post-radiation course. Initially, this publication that you see here on the left, this graph on the right side of the slide, is coming from the publication by Zager et al. This was published in 2017 as part of the trial where they did SPECT-CT analysis on the patients prior and post left breast radiation to assess the heart damage. They found out there was no added zero toxicity to the heart and cardiac perfusion that the users looked at for their cohort of the patients, meaning that with left breast radiation, Align RT-based approach for these patients, you'll be able to prevent any added toxicity and any added cardiac damage to the patient later down the line. SGRT-based approach are also utilized for very highly accurate and demanding treatments like SRS, SBRT, where accuracy, of course, is sub-half millimetric. So we need to be able to track the patients with accuracy less than 0.5 millimeter at all times. And SGRT is a good solution for real-time tracking in those cases. So we'll be able to visualize the patient even if the patient radiation delivery is non-coplanar. So with couch rotations, with non-coplanar deliveries, we will be able to reduce the dose let's say, we will be able to reduce the dose at the organs at risk and make the dose more conformal, making sure that we can escalate the dose where needed. And with SRS and SBRT solutions, we can opt out for open face masks for patient treatments for SRS with increased patient comfort and without detriment on accuracy, as well as for the SBRT based treatments, we can utilize Align RT for live monitoring, interfraction motion management, as well as the breath holds treatments where this is necessary. With this new advances SGRT, there comes, of course, the new form factors of the Linux, like board-based Linux solutions with compact gantries. And in this case, when we go into the SGRT solutions, we know that as soon as the patient goes from setup position to the treatment position, we'll be able to not be able to visualize the patient anymore. There will be significant shadowing. So with Align RT solution, inboard solution called Align RT Inboard, we'll be able to now have a miniaturized cameras inside the board, and we can monitor the patient during the whole treatment delivery and facilitate the breath holds, gating workflows, and interfraction motion management workflows for those form factors, especially when it comes to adaptive workflows as well. This is an important standard. SGRT is also a part of the markerless and deviceless simulation solution, so you can perform specific 4D CT and DIBH acquisitions without any devices onto the patients. You utilize the surface captures, you have the SGRT camera on the CT linac, and you'll be able to take any breathing point, any specific breathing point on the patient surface, record the curve, and do a 4D CT simulation or do a DIBH simulation with the coaching specifically. And at the end of my presentation, I'm going to talk about two new additions into the SGRT family. And the very first one is the SGRT for non-coplanar planning. This solution is called MEP-RT. We are capturing the patient's full geometry with the complete accessory set, the simulation, and we can put that geometry into the 3D scanned simulated bunker of your current linear accelerator. So, and from there, we can calculate and we can see exactly full collision map of the radiotherapy delivery even before the planning is complete. And we can see which angles will be safe for delivery and in which angles you will have a collision between the couch, the patient, and the gantry, here marked by red in this specific image. You can check your patient position at the sim. You can also avoid any dry runs or clearance issues on the day one, as well as you can improve your plans by going non-coplanar and reducing the organs at risk dose and also increasing the tumor control dose by having the more options to deliver the dose from more non-coplanar angles. SGRT for dose monitoring is also a new solution. It's called Dose RT. It uses the Cherenkov imaging effect when radiation enters or exits the patient's body. You can visualize the dose delivery and the fluence directly on the patient's beam, and we'll be able to monitor how the dose delivery was going on through the patients and also analyze it retrospectively afterwards. The current publication, also published in Astro Red Journal, says that about 10% of patients have some issues in the dose delivery that can be visualized by the Dose RT product and can be also prevented by having the online interruptions or online check and correcting the patient's position or specific positions on the patient's body. Here you have some examples of patients' chin going into the radiotherapy field and also the mismatch between the bolus placement on the chest wall versus the radiotherapy field directly seen during the delivery of the dose. So the first time in radiotherapy history, we can truly visualize the dose directly during the delivery onto the patient. Where to find more information, I really recommend you to visit two specific portals. One of them is Safer Radiation Therapy. These are patient-specific portal where the patients can go search for HGRT-based treatments, and providers and departments around the world that provide those tattoo-less safe radiotherapy to everyone. There are many profiles of departments, oncologists providing the service to the patients, and as well as the HGRT community, which is the scientific community for the surface guidance users in radiotherapy, has now more than 10,000 members. It's free to join for everyone. And the community does many scientific conferences. The next one is going to be on December 1st, live streamed, and also face-to-face conference for the whole Europe EMEA region. And it's going to be held in the UK, London. So thank you very much. I'm happy to connect. Here's my contact information. If you have additional questions, I'll be happy to discuss this with everyone. And thank you again for invitation to the district.